We got the tissues, the pigs. They were presented with clinical history of, lethargy, weight loss, and diarrhea, and also some respiratory distress. And we treated that case as we usually do here. We assessed all those tissues. We evaluated them histologically. We did some ancillary testing. They were negative for pretty much all viruses and enteric agents that commonly affect pigs. And then histologically, we saw some lesions that could be associated with Toxoplasma gondii. And then we did some PCRs and IHCs, and we confirmed that.
Welcome to the Swine Health Blackbelt Podcast, the latest swine health research digested for you. My name is Dr. Clayton Johnson, and I'm the host of the podcast. And joining me in our podcast studios this week is Dr. Rodrigo Paiva. Dr. Paiva is a PhD candidate and anatomic pathology resident at Iowa State University's College of Veterinary Medicine and a veteran of the podcast. So, Rodrigo, thank you very much for coming back on the show. If you would, why don't you start with a brief introduction for the audience?
Sure. Thanks for having me again, Dr. Clayton Johnson. It's a pleasure to be here. As you said, I am currently a diagnostician trainee here at the D Lab at ISU. Before that, I graduated from Brazil back in 2013, and then I practiced with the swine industry back there and came to Iowa State in 2021 to start my journey over here.
Well, your journey as a diagnostician means you see a lot of unique cases, and we're here today to talk about a particularly unique case where you saw with an organism called Toxoplasma gondii. Toxoplasma is a unique pathogen because it's a food safety concern. It's a zoonotic concern. I mean, we preach that stuff all the time in the pork industry. And before we dive into the specifics of the case, I think it's really important to highlight that while we're going to talk about a food safety concern, pork is safe to eat. This is not a situation where, the Toxoplasma is causing a food safety concern. We don't have, as I understand it, there are 0 cases of Toxoplasma in the U.S. from pork consumption. And even if somebody had a contaminated piece of pork, they would have to eat it raw, essentially, for themselves to get sick. So if you're cooking your pork, you're 100% good to go. Is that a fair way to wrap it up, Rodrigo?
Absolutely. There is no cases reported in the U.S. USDA has a surveillance program for that, and it's clear that the prevalence in commercial farms with high standards of hygiene and biosecurity practices are less than 1%, really, really low. And this prevalence can be a little bit higher in case of small farms, backyard farms, with like free range and pigs being raised and having contacts with the definitive host of this protozoan parasite, which are felines like the cats, wild cats, and domestic cats. That's probably the main, and it's a really important message here. So there is 0 concern in terms of pork safety. And it's more of for those small farms and veterinarians, I would say that attend those farms, mixed animal vets that should have in mind the importance of biosecurity practices for those small farms, and make sure that you're raising your pigs away from the definitive host of this parasite, and everything is going to be good from that end.
And really, for the pig farm, we have to be concerned about this organism because it can cause disease to our pigs. Our pigs can get sick, and there can be significant performance losses. So why don't we start there, Rodrigo? Let's maybe tee up the case. What sort of history and signalment did you get from the client, or was it kind of like the cases I send you, where it's just a bag of bad tissues and no history or signalment to start with?
Yeah, this was, like you said in the beginning, a unique case here. Managed with here at the lab, and Dr. Madsen, Darren Madsen, was the main coordinator here as well. And I helped him to kind of dig a little bit deeper on that. But long story short, we received those tissues from a really small farm with history of pigs being raised with open access, and this farm has also feedlot cattle around and some cats that were around as well, barn cats. And we got the tissues, the pigs. They were presented with clinical history of, lethargy, weight loss, and diarrhea, and also some respiratory distress. And we treated that case as we usually do here. We assessed all those tissues. We evaluated them histologically. We did some ancillary testing. They were negative for pretty much all viruses and enteric agents that commonly affect pigs. And then histologically, we saw some lesions that could be associated with Toxoplasma gondii. And then we did some PCRs and IHCs, and we confirmed that. But yeah, and then after confirming that, we called the vet again, and we started to investigate a little bit more. And then we start to identify all those risk factors, let's say like that helped us to understand better what happened in that situation. So basically, like I said, that small farm, those pigs, they were raised with bedded with straw, and the cats had access to their feed, to their water, perhaps. And then we started to speculate a little bit more how that happened. So I would say pretty much that's what we got in terms of that case. So, like you said, pigs can develop systemic disease from that. It's really, really rare. And we have very few reports in the literature about that. But I think it's just to remind us, again, what is important, right? Biosecurity is important in my mind, regardless of the size of your farm or of your pig farm, I guess. So, raising your pigs away from other animals, it's important to keep them safe and healthier.
What did you notice in the tissues histologically that kind of tripped the trigger to say Toxoplasma may be involved in this case?
Yeah, we saw interstitial pneumonia, as we see with other viruses, for example. But in this case, you usually see the protozoan cyst within isthmus or within airways in the lung. In the liver, we saw as well a necrotizing hepatitis and also a necrotizing enteritis in those pigs, with having the protozoal cysts like in different systems within the pig, pretty much systemically affecting the pig and causing this necrotizing enteritis and interstitial pneumonia that, in the end of the day, was the systemic correlated with the systemic and the clinical disease that we were seeing in the farm.
And with this being a really, really, really rare pathogen to identify in commercial production, I would assume there's not a lot known out there about how to treat this situation. So it's unfortunately a situation where once we make the diagnosis, we don't have a silver bullet necessarily that's going to make the pigs better immediately. Is that a fair way to look at it?
Absolutely, I guess. There's not much information about treatment. It's much more about prevention, like I said. Again, if you keep your pigs away from either domestic and wild cats, you're pretty much going to be safe. Because cats or felines, they are the only ones that can eliminate or excrete the oocyst, the resistant oocyst within their feces. So if you don't have that cross-contamination, you're pretty much safe there. And since it's pretty close related with coccidia in pigs, we have cystoid phosphorus suis commonly affecting pigs, and we treat for that. Probably we could be treating for Toxoplasma gondii as well, but there is, again, very little information about that. It's much more about prevention.
Salmonella presents significant challenges to pig health and performance and poses food safety risks to humans. As the first and only vaccine offering live attenuated strains of both Salmonella cholerae and Typhimurium, Enterosol Salmonella TC from Boehringer Ingelheim protects pigs against both serotypes with a single oral dose. Talk to your Boehringer Ingelheim representative to learn more.
And prevention is biosecurity. It's not a new concept for the pig industry for big or small farms. While a lot of times when we think of biosecurity, Rodrigo, we think of a bottle of disinfectant, right? Some sort of chemical disinfectant and hygiene and sanitation. But exclusion of certain risk factors is a very appropriate way to do biosecurity. And when it comes to contact with rodents, contact with wildlife, contact with cats, really exclusion needs to be what we apply, right? We can't make the cat walk through a boot bath, and we can't make the mice and the birds take a shower when they come in the farm. So we've got to exclude those critters. We've got to exclude contact with those critters, whether it's inside or outside production. And I get that that's harder to do with outside production, but the reality is we can't hide from the biologic facts of that situation. That when pigs are outside, there's a significant risk that's going on there biosecurity-wise that we've kind of given up control over.
Yeah, absolutely. I think you summarized very, very well all that. We always have to think a little bit outside of the box in that sense of how can I keep the feed that I'm providing to those pigs safe, away from any kind of cross-contamination, right? This is important to other diseases as well. Feed and water. I think if you work on those plus all that you mentioned, I think we're going to be good there.
Excellent. Well, again, just to reiterate for everybody out there listening, this pork is only of concern if somebody's consuming it raw. So if you're having pork sushi from an animal that was exposed to Toxoplasma, that would be a challenge. But in commercial production, just the exposure we think is way less than 1% from that USDA monitoring program. Correct?
Correct. Absolutely.
So as always, cook your pork and it will be safe to eat. No human cases from this, but certainly a very interesting case from an animal disease situation, one that is preventable and unfortunately for the pig industry, a rare one.
Yep, absolutely.
Very good. Rodrigo, thank you so much for coming on the show, sharing that interesting case with our audience. It was great to have you on again.
Thank you, Dr. Clayton Johnson. It's always a pleasure.
Well, we should thank our audience, Rodrigo. To everybody out there listening, thank you so much for your continued participation in the podcast. If you would, take a moment, please like and subscribe to the podcast. It's great information, and if you like and subscribe it just helps with the algorithms to get our message out to more and more pig producers who can benefit from it. For Dr. Rodrigo Paiva, I'm Dr. Clayton Johnson. It's been a pleasure to chat with you, and we hope you have a great rest of your day.